Hi, everybody. Welcome to this month's SameYou AMA, where we're going to take any questions at all from the public on the topic of concussion and concussion care. It's great to be here with you again. My name is David Putrino, and I am a professor in the Department of Rehabilitation and Human Performance at the Icahn School of Medicine at Mount Sinai. And I serve on the board of SameYou. So it's a pleasure to be with you and excited to answer any questions that you may have.
Hello, everybody. My name is Maddie. I am one of the volunteers with SameYou, and I'm a medical student. Today, we're very excited to ask a lot of questions to Dr. Putrino, and we'll have questions from our audience ranging from all these different topics. And we'll go ahead and start with our first question from our audience member. And the question that we have here is, how long after a bump on the head can a concussion be diagnosed? So our first question is concussion themed.
Okay, so if I'm understanding the question correctly, we're sort of thinking about when a concussion can be diagnosed after a bump on the head. And the answer to that question is, depending on the severity of the concussion, we can make the diagnosis within minutes to hours of the initial head trauma. So if someone takes a bump to the head and they're immediately noticing prolonged dizziness, and when I say prolonged, I mean that, when we take a bump to the head, sometimes you might feel a little bit disoriented or a little bit dizzy, and it very quickly subsides. And then you go, wow, that was I didn't like that. That was a terrible bump to the head, but now I'm feeling okay. That doesn't mean that you don't have a concussion. It just means that many of those symptoms have subsided, and for the time being, you're feeling okay. However, if you take a bump to the head and you have this dizziness that really isn't, going away, or you have pain that is really prolonged for 30 minutes, an hour beyond that initial hit to the head, a trained medical professional may take a look at you, see that some of your eye movements are a little bit sluggish, see that maybe you're not responding in the way that you should, and a concussion diagnosis can be made. Also, something that can happen is that, weeks, even months after a knock to the head, if you go and see a medical provider and say, listen, I have all of these new symptoms that occurred after I experienced a bump to the head, that medical provider may also choose to diagnose you with a post-concussion syndrome or even an active concussion. And so, there really is quite a range for when that concussion can be diagnosed. What we're always looking for, our North Star, is what are new symptoms that have emerged since that bump to the head. You didn't have these symptoms before, you got bumped on the head, now you have symptoms. That's how we think about concussion and concussion diagnosis. Maddie, do we have any other questions?
Thank you for that. Can you speak about what types of symptoms are typical usually for a concussion?
Yeah, so, concussion can have many different symptoms, and some of these symptoms, can be quite mild or quite difficult to pin down. A lot of people will simply report that they just don't feel themselves, or they feel, just a little bit off. So they can be very vague symptoms, this sort of like general malaise or just feeling like something's not quite right. And then there can be very direct symptoms. So individuals can be experiencing, chronic headache or a head pain that won't go away, dizziness, slowness in thinking, so difficulty with cognitive processes. We often see some of the most sensitive symptoms. Maddie, you may want to go on mute. Some of the most sensitive symptoms that we cognitive processes that we see will be things like speech and short-term memory and processes that just take a little bit more cognitive horsepower. So the ability to plan things out, the ability to navigate through a new space. These are sometimes some of the most effective cognitive processes. And so there are a range of symptoms that people can experience. I think it's also important to note that if you are experiencing some very serious physiological changes, so if you have head pain that is escalating, so it's getting worse and worse and worse over time, that is a sign to get yourself to a hospital and get immediately checked out by a doctor. If you're noticing unusual symptoms like a clear fluid coming from your nose or a clear fluid coming from your ear, again, that's a sign to get yourself to the hospital after a knock to the head. And also, if after the knock to the head, you're experiencing rapidly escalating symptoms, your dizziness is getting worse, you're finding it harder to move your eyes from side to side in a room, these are all signs that you should get yourself to a doctor as soon as you can, and get your neurological system checked out.
Thank you for that. The next question has to do with recovery from a concussion. And so the question is, why do some people recover quicker than others when it comes to a head injury or a concussion?
Yeah, this is a really great question. And we do not have a direct answer to this because we think that the answer is a little bit complicated with regard to past medical history. So what has happened in a person's past that may affect their recovery from a concussion. So someone who has had multiple hits to the head, for instance, may have a harder time recovering than someone who's had their first concussion. This is a fairly well-researched phenomenon, and we know it to be a factor in brain injury recovery and concussion recovery. Similarly, we have started to understand that there may be genetic predispositions. So people, because of certain genes that they may carry, may either find it easier or harder to recover from concussion. And then there can also be simply anatomical changes or anatomical differences from person to person that lead to mechanical reasons why concussion may be difficult to recover from. What I mean by that specifically is when someone sustains a concussion, they experience inflammation in their brain. So all of these chemicals that your body usually uses to help you heal get sent off into your brain. And in most cases, it can be quite easy to clear that inflammation as quickly as it appeared in your brain. However, depending on where the inflammation goes or where the inflammation settles, sometimes that inflammation can be trapped and it can actually be hard to get out of the brain. And so people experience ongoing symptoms. So this combination of anatomy, where the injury was sustained to the brain, where the inflammation is concentrating in the brain, paired with your genetic background. So what is your sort of, genetic and physiological propensity for recovery, paired with your past medical history. What conditions may you already have that could affect your recovery? All of these factors together build into this complicated picture of why some people recover quickly and other people don't recover so well.
Thank you so much. We have a lot of great questions coming in the chat about concussion,
Fantastic.
and I love this next one. This is a question, I think, from a parent asking about, for children who are passionate about sports, can you speak more about how a concussion or brain injury may affect them both physically and emotionally? And what can parents, coaches, and teammates do to help an athlete, young athlete, through that concussion recovery journey?
Okay. Well, I think probably the probably the most important thing that we can do for kids who are recovering from a concussion is make sure that uh, we're observing very safe return to play protocols, and making sure that we are protecting them from further injury or further re-injury after that concussion. What that looks like is, depending on the sport, making sure that a very careful return to play protocol is occurring. Kids who are returning to sport after a concussion are always going to tell you that they're fine, or I shouldn't say always, but I will say 99 times out of 100, kids who are returning from a concussion, they want to get out there and play. And so they're going to tell you that they're okay. What parents and coaches need to be looking out for, and medical staff and medical teams who are following the concussion, is signs and indications that they are not quite themselves while they're out on the field. So are they making bad decisions? Are they seeming to show inattention that is unusual for them? Are they not able to keep up with the play in the way that they usually keep up with the play? Just looking for signs that they're not quite right, that their endurance is suffering, that their decision-making is changing. We're also looking for signs and symptoms off the field. Are they not recovering quite as well from exertion as they usually do? Are they needing more sleep? Are they photosensitive? Are they experiencing emotional outbursts that are unusual for them? How is their sleep? All of these things that we're trying to understand about a recovering brain. So I think first and foremost, the most important message is, we want you to return when you're ready to return, and you shouldn't feel any pressure to return too early. And I think that has to be the unified message that the coaching staff, the medical staff, and parents are all telling a young person who's recovering from a brain injury, from a mild or moderate or severe concussion, because legitimately that is the most important thing that matters, both in the moment, to make sure that we're preventing long-term symptoms, and also across the course of someone's career. This is, especially if they plan to get serious about their sport, making sure that they fully recover before they get back out there is the way to ensure longevity in a sporting career. And so this is, making sure that there is good communication between all of the adults who are managing this young person on the field and off the field, and making sure that everyone is checking in with this young person as they're recovering, making sure that we're not giving them more than they can handle in the course of their recovery.
Thank you so much. And we have a lot of great questions kind of flooding in the chat right now. So this is very exciting. One question that we had, not just about concussion, but about brain injury in general, is, do you have any tips for people who have a hard time sharing or disclosing their injury with their friends, family, other people? Like how could they, what communication skills do you recommend that people can maybe lean on if they're having a hard time describing how they're feeling and their new cognitive baseline, let's say, with others?
Yeah, I think this is such an important question, because I think that brain injury can be such an invisible illness. I think many of the people who come through our clinics who speak to us about their brain injury, when their brain injury has been mild, but mild from an anatomical standpoint, but they're still experiencing symptoms that affect their function, is they frequently get told, well, you look fine. So, we don't quite understand, why you say that you can't do this or you can't do that. And I do understand, and it's frequently, brought up to me that that this is, a really challenging piece of brain injury recovery. I would sort of go in two ways with this question. One of the things that we have found to be so helpful for people who are recovering from brain injury and other disabilities as well is getting involved in peer support and social programs around brain injury, where you can meet other people who are going through what you've been through and speak with them about it, and and find people that you can sort of trust from a shared experience standpoint to talk about what you're going through, and have someone who can really relate to you in terms of, well, yes, I've experienced this as well, and it can be really hard, and this is how I got through it, et cetera, et cetera. So working on getting involved in programs such as these can be really, really helpful in being seen, in being understood, and helping you, through tough times after a brain injury. And of course, there are most places will have local programs for this. Of course, there are global programs. SameYou's is a really wonderful charity that helps people to share their stories. There are other, engaging sort of patient communities. You can even find, social media groups where people will get together around, a single topic. And so I think that can be really powerful and really important. When it comes to sharing with existing friends, I always sort of advise people who are asking me this on, starting small. So starting first with a very close friend who that you can tell anything to, and starting with a disclosure to a close friend, and just saying, hey, listen, I've been having this problem since this incident, so I got a bump on the head. Ever since I've had a bump on the head, I'm working with a doctor, but, I'm really struggling in environments like this, or I'm really, having problems here. And asking that person, after disclosure, asking that person to be an advocate for you. Would you mind if we find ourselves in a situation like this? Can you just help me out socially? If I need to leave the room, can you sort of help create a space for me to be able to leave the room without causing a scene, without causing a problem, without, and so having an advocate in the room is always really powerful. So that's usually where we start, with getting comfortable disclosing to somebody that you really trust, somebody that you can ask to be an advocate on your side. Can I ask you that, when something like this happens, you can help me with the rest of the group to sort of smooth things over and make me feel comfortable. I know that that's a big leap of faith, but it makes such a difference to just have one ally, one person that you can rely on in social situations to have your back. And so between finding social support groups and peer support groups, and slowly starting to introduce, and make disclosures with people that you really trust. And once you get more comfortable, making those disclosures with other people becomes a lot easier, is something that our patients have told us. So I hope that that's a helpful answer to the question.
Thank you for that. I think a follow-up question that we had, kind of going off of the idea of stigma and finding a good companion to relate recovery from, is, can you talk a little bit about, just for people who might not be as familiar with brain injury, what are some common stigmas that people unintentionally believe when it comes to it being a silent illness or a silent injury?
Yeah, I think probably the most common issue that a lot of people with brain injury face is it is just the sense of maybe this person is faking it, maybe this person has some sort of other psychological diagnosis as opposed to a brain injury, because I can't, again, this theme that comes up often when our patients at our centers are speaking with us is being told, well, you look fine. You look fine, so I can't understand why you're having all of these problems. And I think that that's probably one of the hardest things for many people who are recovering from brain injury to manage, is being told, well, I don't understand why you're telling me about all of these symptoms when you look healthy. I also think that in addition to that stigma that is often put out there of this sort of slightly gaslighting, or well, I shouldn't say slightly, I would say gaslighting situation of being told, well, maybe I don't believe you because your appearance doesn't match what you're telling me, which is common in invisible illnesses like brain injury. Something else that is frequently reported is a sort of perceived lack of competence when people disclose a brain injury. So again, this is a stigma that many of our patients with brain injury face when they disclose to, I would say, quote unquote, the wrong person, somebody who's not well educated about brain injury and the manifestations of brain injury and how common brain injury is in the population, that, oh, well, if you have a brain injury, maybe you're not as competent as the person next to you. When in fact, competence and intellect, of course, is not directly proportional to a brain injury. People can have a brain injury and be highly successful and highly competent, but still have symptoms like cluster headaches and dizziness and energy envelopes where they can be highly productive in a certain amount of time, but they also require brain breaks to be able to continue on. And yet many of these stigmas still persist. So these are things that I think, like as with all stigmas, can be challenged and corrected with good education. And so, I'm always very, very privileged to be able to, speak at events such as this to really help with education and breaking down that stigma.
Thank you so much for that answer. And I can imagine that it's an isolating feeling. And to your point before, having good community like what we have here at SameYou, people who have gone through similar experiences, can be valuable. Kind of shifting focus a little bit back to some of the previous questions we had about concussion, talking about a sense of belonging. We had a question about how athletes and other sports players sometimes can feel isolated when they have a concussion because the duty that they have for their team and the sports atmosphere. Can you talk a bit more about like the athlete's identity when it comes to recovery from an injury, and kind of any tips you may have for any athletes who are trying to still be a part of their team but are dealing with concussion and recovery from concussion?
Yeah, it's a great question. And, I think that the athlete mindset is, no pain, no gain. I'm going to power through this. I'm going to push through this, and I'm going to get to the other side. And I think that what makes concussion recovery so challenging for many athletes is that, concussion is one of those injuries where you can't really just push through and everything will be okay. Sometimes it requires radical rest. Sometimes it requires active recovery. Sometimes it requires you to set boundaries around how hard you can push that are going to be dynamic. So one day you can do quite a lot. Other days you need to sit and rest a lot more. And I think that unpredictability really can get in the way of the general process that we see in most athletes. And I understand how it can be so isolating for athletes, because it also gets in the way of, if you're in a team sport, team dynamics. Team members will sort of be like, well, you seemed fine on the field yesterday. Why is it that today is a harder day? And so it really, once again, I sounded a little bit like a broken record, but it really does come back down to making sure that the medical provider or the coach on the team is educating the whole team about what a concussion is when a concussion happens. Educating the whole team that this athlete has sustained a concussion, so we're going to let recovery occur at their pace, not at the sort of expected pace of the team. Because again, unlike a lot of other musculoskeletal injuries that happen during athletic performance, where we can say, oh, you tore a muscle, that's a 4 to 6 week recovery, and we're going to do this, and we can see on an X-ray or an MRI how well this injury is recovering or not recovering. You don't have such firm timelines on recovery from concussion. We have a few ideas, but always these guidelines are very soft, and we have to go by how the athlete is feeling. And again, as you can imagine, that level of uncertainty can breed feelings of insecurity in the person who's recovering. It can breed feelings of isolation in terms of how this athlete is interacting with the rest of the team. So the extent to which we can make sure that everyone is well educated and well briefed on concussion recovery, the better things will be.
I think, similar but different. We have some questions in the chat about a different type of team dynamic, and that is in the workplace. And we had a comment here, and you kind of said this about when it comes to hidden impairments, sometimes the workplace managers have a harder time understanding because they can't see what they don't know, is going on beneath the surface. So I'm wondering if you could speak to that, similar to educating teammates. How do you advise someone to maybe educate their coworkers and or manager who may be supporting someone who's going through either a concussion or any type of TBI or brain injury that may be less evident to the general population?
Yeah, it's a great question. And, in a perfect world, what I would say is best practices is that this is a responsibility for your care team. And so if you are a person with a concussion who is under the care of a healthcare professional and you're feeling as though you're experiencing this, really making sure that you discuss this with your care provider and say, look, can you provide some materials to my boss? Can you write a letter? Can you provide some level of explanation of what I'm going through? The expected timelines and and open lines of communication between the manager and the healthcare provider, so that an open dialogue can be occurring to to make sure that everyone is staying educated about what recovery is looking like in this case. I think that the advice is somewhat similar, but a little bit different to a sports team, because often a sports team does have a healthcare provider on site, and it's accepted that the healthcare provider is talking to everyone on the sports team. Especially as you get more and more professional in professional sport, the medical team is part of the team, and although we don't have that perfectly emulated in the workplace environment, that's what we've got to get close to. We've got to get as close as we can to the healthcare provider who is managing this complex process of concussion recovery, speaking with the manager, educating the manager, letting the manager know this is what concussion looks like, and this is what your employee is going through, and this is what I'm asking of you as the person managing the care of the patient.
Kind of similarly, a couple comments in the chat just about people being afraid to disclose a long-term concussion or an underlying diagnosis because they're afraid of maybe backlash from a manager or in the industry. And the comment that we see here in the chat is that industry needs to change. Wondering kind of what your thoughts are, or maybe any other tips that you may have in disclosing something so personal to in a workplace setting.
Yeah, the topic of disability disclosure, or disclosure of a health condition, is a really personal one, and it's one that is very hard to advise on generally, because we can never know the environment that somebody is in. I can speak from the perspective of a perfect world. We have things in the United States like the ADA, the Americans with Disabilities Act. We have disability rights programs in the UK and Australia. In most developed nations around the world, there are legal protections in place to protect someone from a disability, to feel safe that they can disclose their disability and request specific accommodations around that disability. The reason I call this complicated is because in the real world, often we will hear stories of people being very overtly discriminated about disclosing their disability, and finding that they have very little recourse if they are in fact experiencing some level of discrimination as a result of their disability disclosure. And so, again, in a perfect world, we're always going to err on the side of disability disclosure. It can be hard, it can be challenging, but more often than not, when you clue someone in to go what's going on, and you say, these are the things that I need to be most productive, that is usually a helpful conversation. However, I'm always, a little bit nervous about, again, providing that as blanket information, because I don't know everybody's individual situation. And sometimes there are some people out there who may use this information in a less than honorable or less than good-spirited way. So ultimately it becomes a very personal decision, and these are things that need to be considered carefully.
I think that was a really great and honest answer. And also just kind of plugging SameYou. We have a lot of back to work resources on the website. So if you have more questions on this topic, that might be a good place to start as well. Kind of shifting gears a little bit, we had a really good question about the difference in recovery for men and women. Kind of a very broad question, but I'm wondering if you can comment a little bit, maybe to talk about stroke recovery, for example. This person was asking about any noticeable changes between men and women when it comes to recovery that you've noticed in your practice?
I would say that across the board, we do we don't always see sex-specific changes in recovery, broadly speaking. So when you're looking generally at outcomes, if we're talking about stroke recovery, when you're generally looking at outcomes of who's recovering more or who's recovering less, there isn't really a solid trend, or I should say that variables like gender aren't necessarily the most important variables for determining how much of a recovery somebody is going to make, or the sort of magnitude of recovery that somebody is capable of. On a more individual basis, something that I will say, especially when we're dealing with people who are recovering from a brain injury, who are menstruating. So, when people are experiencing hormonal cycling, we can see more complexity layered into their neurological recovery, because hormones of ovulation, such as progesterone, such as estrogen, even up to and including luteinizing hormone and follicular stimulating hormone, these are, the main hormones of ovulation, can really drive inflammatory processes and immune dysregulation, especially if the brain injury is also causing hormonal dysregulation. And so rather than saying that men recover, more or less than women, what I will say is that the increased complexity of hormonal cycling in women has to be addressed, and it's not addressed nearly enough. So this is something that should be asked of every stroke neurologist. If you're a woman recovering from a brain injury, if you're a person who menstruates recovering from a brain injury, you should be saying, how is my menstrual cycle? How are the hormones that I'm taking? How are the hormones, how are my general hormones of ovulation affecting my recovery? I feel like this during this part of my cycle. Is there anything that can be done? I think that is a very under-researched but extraordinarily important part of recovery.
Thank you so much. And kind of teasing more SameYou excitement, we'll be doing a Women's Health Month in a few months from now, talking a little bit more about some of the topics that were just answered. So that's to come as well. Lots of diverse questions in the chat. I'm going to shift gears a little bit and talk about some of the treatment-specific questions that we have here. One question that came up is about, very specific, asking about intermittent hypoxia treatment. Wondering if you could maybe define that and maybe talk a little bit more about that for this question that we had in the chat.
Yeah, so intermittent hypoxia treatment is a treatment where you either create a situation, a physiological situation where the central nervous system is experiencing hypoxia, which is low levels of oxygen, or you create a situation which is called relative hypoxia, where the brain thinks it's experiencing a period of hypoxia, but really what you're doing is you're taking it from a very high oxygen state, where you may use something like a hyperbaric oxygen chamber, and then take that oxygen away. So when the brain feels that shift in oxygen change, it says, oh my God, I'm hypoxic, but actually it isn't. It's not experiencing true hypoxia, but it's experiencing relative hypoxia. And in general, the outcome tends to be the same, which is what we've seen in a lot of really interesting studies is this can reopen critical periods of plasticity. So neuroplasticity is a mechanism by which our brain rewires itself. It occurs during learning, but it also occurs during injury. And it is a mechanism by which we are able to recover the central nervous system after injury and allow for, for gains to occur. Now, immediately after an injury, we have a lot of neuroplasticity occurring as the brain is rapidly and urgently trying to remodel itself so that the person can go on functioning. But as you move into more chronic periods of brain injury recovery, you get less and less plasticity. So you need to work. It's not that you can't make gains, and it's not that your brain is not capable of neuroplasticity, but you need to work much, much harder for less gains once that immediate post-injury plasticity window is closed. And so relative hypoxia or intermittent hypoxia training can reopen these critical periods. And so what a lot of studies have shown is that if you pair relative hypoxia with intensive training, you get much better gains than if you just do intensive training alone. Interesting question. Not a lot of people know about intermittent hypoxia.
Thank you so much. That's so interesting. Kind of also another treatment as question, and this one's coming up a lot. Can you speak a little bit about your thoughts on the future of AI and some of the up and coming recovery and rehabilitation treatments in the TBI space?
Yeah, absolutely. You know, I think that the thing that excites me about the role of AI in treatment recovery is, as I've sort of mentioned throughout this AMA, when people ask me like, why does that person next to me recover and I'm not recovering as fast, or you know, what is the best thing that I should be doing personally to recover maximally? The answer pretty quickly comes down to personalized medicine. The answer pretty quickly comes down to who are you on a molecular level, and how do we choose treatments that are optimized for your molecules versus treatments that are optimized for molecules of the person sitting next to you. And I think that AI has a huge role to play in making such a hard and complicated question much, much more simple on a day-to-day basis, and allowing us to really personalize interventions. And this is all the way from really science fiction-y stuff where you know, where you may say, here's a sample of my cells, and this is not a hypothetical. This is research that is going on right now. You know, here's a sample of my cells from a blood test, and based on my particular, you know, genotype, can you recommend medications that are going to work best for me to treat the brain injury symptoms that I'm experiencing, all the way through to just being able to sit with a brain injury informed AI assistant and say, this is my age, this is my gender, this is my weight, this is all the information about me, and can you recommend a concussion recovery exercise protocol based on these informations that's personalized to me? Can you recommend, you know, whether or not I would be a good candidate for red light therapy, or a good candidate for intermittent hypoxia training, or a good candidate for XYZ? And of course, none of this works in isolation. You need to be working with skilled healthcare providers as well. It's not artificial intelligence, it's intelligence amplified. So we want people with domain knowledge to be amplified by an AI product. But that's where I see the future of AI, especially in brain injury, when we're dealing with such complex variables and such what we call high dimensional problems, many variables interacting at once. AI can be really handy at collapsing those variables down and helping to simplify decision making.
Thank you so much. And kind of teasing some more fun SameYou things in the future. We'll be having some Meet the Expert sessions in the future talking about the use of technology in recovery. And so we'll look forward to more questions on AI in the future with that. There was a really interesting question going back to our concussion theme today about helmet use in general in sports, biking. When parents are looking for a helmet for their child, is there any tips on how to know which helmets are good versus not good versus, you know, different? Any tips on that?
You know, in general, I think making sure that you're doing a lot of research, you know, not just choosing the first thing off the shelf, making sure that you're doing a lot of research on the helmet brand that you're purchasing, sport by sport. You know, of course, all helmets are built differently and designed differently, and they're designed with different materials, and they're designed with, you know, some are very cheap and some are very expensive, and price alone does not actually determine helmet quality. so what you really want to do is making sure, that there are websites that, and perhaps what we can do is put a few of these resources up when we release the recording of this session. But there are websites that evaluate helmets and tell you what the crumple zone is, because what's most important about a good helmet is how much it slowly redistributes the impact forces so that the head doesn't slow down too quickly. Because when we're thinking about brain injury and we're thinking about what a helmet does, the helmet is doing two things. It's providing physical protection from an object hitting the head. So let's say in the case of riding a bike and you unfortunately fall off of your bike, the helmet is protecting your head from hitting the pavement. So that is one thing that it's doing, is you don't want your head directly hitting the pavement. And so the helmet is protecting you from that. The second thing that the helmet is doing, and this is a lot harder to protect from, is when you fall and when you hit your head, one of the ways that the brain gets damaged is the skull is hard, the brain is soft. And so when the head is in motion, if the skull hits something and suddenly stops moving, the brain, which is floating around in a bunch of fluid inside the skull, will keep moving and hit the front of the skull, hit the back of the skull, and brain damage will ensue. And so when you're wearing a helmet, what the second goal of the helmet, other than direct physical protection, is to slow that deceleration of your skull so that your skull doesn't abruptly stop. It has some time to slowly decelerate. And then what happens is if it decelerates a little bit more slowly, the brain is less likely to bump against the front, bump up against the back, and cause brain damage. And so those are the two big goals of a helmet. And so doing a lot of research, not just about how much physical protection the helmet provides, but also how much how well the helmet is redistributing the forces of a blow to the head and slowing the deceleration of the head when there's an impact.
Thank you so much for that. Good to know to do some research, lots of research before going out and buying a helmet. We're kind of almost out of time today, and we have so many fantastic questions from diverse topics in the chat. And so encouraging everybody listening to tune in next time if we don't get to your questions today. We'll definitely try and get to them in the future, and we're very grateful for this time. The last couple of questions I want to ask you are about lifestyle in general. And one great question we had was about nutrition, specifically the thoughts on the gut-brain axis and foods that maybe tend to reduce inflammation, turmeric, sauerkraut. So I was wondering if you can comment a bit about just nutrition in general when it comes to recovery and this anti-inflammatory action of some foods.
Yeah, this is a very complex topic, and what I would say too on this topic is there is no one perfect recovery diet for brain injury, and the reason for that is because much of the dysfunction that we see after a brain injury can happen for different reasons. Maddie, you just mentioned things like gut dysbiosis, where we have all of these bacteria in our gut, and some of these bacteria are good bacteria that promote good things in our gut, and some are bad, and usually they stay in balance. And if you're lucky, you have more good bacteria in your gut than bad bacteria, and those good bacteria are doing good things for your gut health. A hit to the head can knock those things out of balance. And so if you experience gut dysbiosis, then working with a registered dietitian or a nutritionist to first take on some prebiotics to try to heal the good gut bacteria, or provide, I should say, prebiotics provide the groundwork and the environment for good bacteria to grow back. And then taking things like probiotics, which are effectively a big dose of good bacteria to get back into your gut, can be very, very beneficial for some people. However, on the flip side, some people after sustaining a head injury will experience something called mast cell activation syndrome. Mast cells are immune cells that live in our body, and they're the immune cells that fight off invaders by releasing, they're our first line of defense, and they release all sorts of inflammatory chemicals, including chemicals like histamine, which you may be aware of like when you get allergic reactions, you experience sort of histamine attacks. Because a lot of our mast cells, around 70 to 80% of our mast cells, in fact, live in our brainstem. When you sustain a head injury, a lot of these can become activated, and they can stay in this cycle of activation where they're releasing inflammation, they're releasing inflammatory chemicals all over the place. And in a case like that, interestingly, taking products like probiotics can actually worsen histamine release and degranulation of mast cells. So in a case like that, what we want to be moving toward is antihistamine diets, and diets that are lower in histamine, diets that are less likely to cause these histamine attacks, and less emphasis on probiotics and diets that will improve gut motility and gut dysbiosis. So depending on the reason why you're experiencing the symptoms has a big influence on the nutrition that you choose. But I think a very important takeaway is that nutrition during brain injury can be extraordinarily important. There have been many, many studies, again, in the correct subset of individuals. There have been many studies showing that things like a ketogenic diet can be beneficial, but again, we need to make sure that that's the right approach for your brain injury. Similarly, something just as simple as many brain injury survivors just don't get enough calories in the day, and making sure that you're not malnourished because you're having difficulty with planning your meals as a result of your cognitive impairment. And as a result, you're malnourished. And as a result, you can't think straight. And as a result, some of your existing cognitive dysfunctions get worse. Across the board, in many review articles, caloric deficit is actually the number one cause of worsened cognitive function after a brain injury. And correcting caloric deficit, just that alone, making sure that just people are just getting the calories that they need before getting into all of the fancy diets, can be a very important contributor to better recovery. So in general, the first principles of nutrition is making sure that you're getting enough calories to support brain recovery after an injury. That's number one, working with a nutritionist who can help you on that. Then you can start to get a little bit more complex. Then you can start to say, hey, what foods are bothering me that didn't used to bother me? And what might that indicate about what's happening in my gut, or what might be happening systemically with inflammation? And then you can start to dig into that a little bit better and start to tailor your diet in a way that promotes recovery for you. But I think the really important point is that becomes very individualized, and there's no blanket brain recovery diet that I've seen that applies to every single one of our patients with brain injury.
That was so interesting. I think one thing that I learned from this discussion today is that recovery from brain injury really is this team sport. It doesn't just involve the survivor or the caregiver. There are so many different parts to it. If it's a coach, if it's an ally, if it's a coworker or a friend, if it's a nutritionist or a doctor. So thank you so much for kind of reminding us that there are so many people to lean on in recovery. It's not just singular in that sense. And that was very impactful today. We're just about at the end of time. We know we've had some fantastic questions, and we'll answer a lot more of these questions in the future. But Dr. Putrino, just to finish off, were there any last thoughts or comments that you had from this great discussion that we had today?
I really appreciate all the questions that came through today. I think that this is a great group who are asking so many wonderful questions. So I want to thank everyone for that. And I kind of want to echo what Maddie said of just the importance of, after a brain injury, understanding how complex recovery is, the importance of trying to find a team as opposed to just being told, hey, you've had a brain injury and things should recover over time, you should be okay. Which is so often, sadly, the most commonplace answer that millions of people who sustain brain injuries get told by their healthcare providers. Really, for the friends, the family of people who are sustaining a brain injury, really help the person that you love who has had a brain injury, find that right team around them that is going to personalize every aspect of their recovery. Because, as Maddie said, brain recovery, especially after a concussion, it's a team sport. Make sure you have the right team around you, and make sure that the people who love you are taking care of you as well.
Well, thank you so much again for your time. I think we all learned something together. For all of you viewers out there, thank you so much for joining us today. And we can't wait to see you next time. We'll be answering more of these questions and sharing this video on our SameYou socials, and looking forward to see you all again next time. And Dr. Putrino, thank you so much again.
Oh, thanks for having me. I'll see everyone next month.